In this video, I'm going to talk about some of the principles of exercise prescription. And those main principles are the overload principle, progression, specificity, individualization, and then reversibility. When we talk about the overload principle, that is, we need to induce adaptation, whether that be strength or flexibility gains. The person must exceed their baseline level of function. So for overloading the tissue, we need to push them into a range that really challenges their body. If we're talking in that strength range, that's going to be somewhere in the 6 to 12 repetitions is how we build strength. If we're thinking more on the flexibility standpoint, that might be 20 to 30 repetitions in a certain movement or holding a tissue for a certain length of time to induce gains in flexibility. And that might be for flexibility several times a day. But the key point is to induce this overload principle, we need to exceed their baseline level of function. And really what that means is we need to know what their baseline level of function is to begin with. What's tricky about this from a pain management standpoint, where many people operate in the physical therapy world, is that we're often managing pain initially. But still, I think this principle applies is if you're doing a 10-pound, let's say, pec fly with somebody and they're not having pain, but 20 pounds hurts, their baseline level of function is going to be 10 pounds because it's what level they can tolerate before the onset of symptoms. So, and because we can look at this from a tissue adaptation or sort of the pain management adaptation of getting them to be able to do an activity without pain. But it needs to be a rigorous amount of exercise or a rigorous intensity of exercise. So we tap into that body's natural adaptation system to create change. Next is progression, and that's gradually increasing the volume, intensity, and complexity of exercise to promote continuous improvement. So if you're doing 10 pounds today, but you're still doing 10 pounds 6 weeks or 6 months from now, you're not going to see a progression. It needs to be, I would say every 2 weeks, we need to see a jump up in the weight. And we're going to see plateaus during that. In the first 6 weeks, we're going to see a lot of gains there due to neuromuscular adaptation. In the first 3 to 4 months, we're going to see even more gains due to actual strength being put on. But then, maybe around the 6 month time, you're going to see a plateau because of adaptation the body's had to a specific movement. But progression is gradually increasing the intensity, the volume, or the complexity of the exercise. Third is specificity. That means exercises should be relevant to the patient's functional goals. The example I give here is if the goal is to improve someone's gait training pattern, the exercise should involve weight-bearing movements for sure and dynamic balancing movements because that's what the action of locomotion requires. If you're just doing static squats to improve someone's gait, well, they might get stronger, but it's not going to help their walking pattern. The same example could be is that if I am working with a tennis player, I'm going to train that person differently than if I'm working with a lineman because the requirements, their functional goals, or the demand of their exercise is going to be unique to them. So we need the specificity of training to be individualized. Next, individualization. Exercises should be tailored to the specific needs of the person. So let's take that tennis player example. Let's say that they have a good baseline level of strength, they have a good baseline level of flexibility, but what they lack is agility or coordination with specific tasks. So then we've taken it from specificity, but we need to individualize the training one step deeper by seeing what the specific needs of that athlete or that individual are. So tailoring it to their specific needs is essential. And then lastly, reversibility. This is almost common sense. It's kind of the bed rest principle that if you aren't working towards progressing overload towards something or progression of something, we're going to see reversibility. So the gains that you have made will be lost if you don't maintain those exercises. This is really tricky because I often say when you're training for something, you're often detraining for something else, meaning that this is kind of a lifelong game that we're playing, that you need to constantly be pushing yourself and constantly working on progression or at least maintenance, because if not, we're going to see reversibility. And that's where we know that sarcopenia is extremely common as people get older, and that loss of muscle mass tissue or the reversibility of what we're seeing in the body is so commonplace because we stop maximizing the gains and we start seeing regressions. So in the next slide, I'm going to share different ways that we can use these principles of overload, progression, specificity, and individualization kind of on the different variables that we can manipulate. So when we look at how we can manipulate variables to help someone with their exercise prescription, the things that I consider are range of motion, the load, the weight, or the resistance that they're doing, their plane of motion, the ground surface, frequency of training. So how often in a given week, you could say a week could be a small cycle or a month period could be more of a chronic workload. Speed of repetitions, the volume that they're going through, position of load, and then the position of the body. Training these in various ways is going to help you kind of one, it's going to make a muscle or a muscle group more well-rounded, but it's also going to expose that individual to a variety of different situations, increasing the complexity of the movements. One, from an exercise progression standpoint, range of motion. Maybe with somebody, if you're working on lunges with them, you start in a smaller range where their muscles can tolerate that. Where you should basically take them to what range they can tolerate. But let's say over time, you can go deeper and deeper into it and get more activation through a larger range of motion. So working on range of motion is a great way that we can manipulate the variables. Load or weight, that's common sense. Like if you start with a certain weight, we want to see gradual progression over time. The plane of motion, let's say we're working with that tennis player. Well, maybe at first, let's say we're working on their forehand swing and they're a right-handed player. We might start with chest pressing movements, but then we work on, which is going to be more sagittal plane. Then we work on some transverse where we're bringing in rotation in addition to the sagittal plane function. And that's going to make that athlete way more well-rounded because we're hitting specific muscle strength, but we're also hitting much more dynamic patterns. Type of surface or type of ground, that would be implementing different, if you're training someone who's a trail runner, you could have them running on even ground, but likely they're going to be going on uneven surfaces, having to dodge rocks and do things. So altering the type of ground surface is a great way to help with the exercise progression and make things more specific. Frequency of training, this is a great way to promote adaptation, is simply to increase the volume per week. So, or the number of repetitions, or however you want to think about it. Speed of each repetition. If I do something in a slow, controlled fashion, let's say for a bench press, 3 seconds down, pause, 3 seconds up, that's going to have a different effect on the muscle than if I go 2 seconds down, power up. However you train the muscle, the speed at which you train your repetitions is going to be similar to the neuromuscular adaptation or how well that muscle can fire in real time. So if an example I gave in a prior video is that for a long time I was playing squash, which is a very speed-driven game. It's kind of like racquetball in many ways, but even more challenging from a dynamic standpoint. How I was training for squash and what I was doing with the speed of repetitions then is much different than now doing jujitsu, which is a really kind of slow, almost isometric hold of positions. So you can train that by training the speed of how you're working repetitions. Volume, position of the load or resistance. If I that's going to be, it's going to help change. It's basically going to be your position relative to gravity. So if you can change how you're working a muscle relative to gravity, that's going to give you options on how to train a muscle differently. Position of the body, you could think about that as if I'm doing a bench press supine, I might also train that muscle with a pec fly motion. So you could do how you train that muscle throughout various positions is going to change your base of support. It's going to change your core activation. It's going to make that muscle, that individual more well-rounded or whatever based on their individualization or specificity. With these, this is going to be, you can play around with these variables based on what that specific individual's needs are. So I think about this as ways to both progress and regress something for each individual person. It won't be a one size fits all. Maybe with someone you're tweaking 3 or 4 of these variables, with someone else, you're looking at 3 or 4 different variables. But this is my approach to how I look at exercise progression. That includes from the pain management side, using some of these graded exposure principles, but then also how I take that from the PT clinic into more of an athletic training population or an advanced population where we're getting into higher strength training.